Welcome everybody. I'm glad you could come out this evening. We're so very excited to have Dr. Deborah Matthew here from Signature Wellness. And I'm excited that they're here because I've had the opportunity right now in my life to work with them, and I'm gonna tell you they are just excellent group of people to work with. And I know she's going to give you some very poignant information that you can use to help jumpstart yourself. You know, here we're always talking about health and getting healthier and making the small changes. Well, I know she is going to speak to you and talk to you about that, and certainly on a different level than what we do here. So, Dr. Matthew.
Okay. So I want to start off by asking you this question. What does it mean to be well? What does it mean to you to be well?
To be mobile.
To be mobile, okay. What else? What does it mean to you to be well?
Think about wholeness, but I think spiritually, emotionally, physically, all of that brought in together.
Yeah. What does it mean to you to be well?
Probably like she said, to be active, to not be depressed, to have a desire to get out and do things, and to be able to go to the bathroom every day and have a bowel movement.
The simple things in life, right? But these are good because sometimes when we say, what does it mean to be well? People say, well, to not be sick. But to not be sick isn't really good enough, right? We want to have energy and good mood and be able to enjoy and have a good quality of life. But what do you see happening around you? Do you see people getting more and more energized and feeling better and better? I mean, that's not really what I see. I see that Americans are really struggling. We're having struggles with our weight. We've got skyrocketing rates of diabetes and cancer, and people are getting on more and more medicines, right? Antidepressants and heartburn pills and all kinds of drugs. And really, at the end of the day, those medicines can't really make you well. They can sort of just put a Band-Aid on the symptom. So I would even really go so far as to say that I feel like we have a healthcare crisis in America. Do you agree with me that our healthcare is really a problem? And I don't just mean how we're going to pay for it, and I don't know what's going to happen with our healthcare system, but I'm actually talking about our healthcare. So let's talk about some of the facts, if I can make this work. So we have the most expensive healthcare system in the whole wide world. We spend more money than everybody else. So if we spend more money than everybody else, is it not fair that we should be the healthiest people? Where do you think we are? People crunch the numbers. They look at life expectancy, infant mortality, all kinds of statistics, and then they rank the countries. Who thinks that America is the healthiest? I wouldn't even ask the question, right? But who thinks we're in the top 10? Top 20? Top 30? We're number 37. That's pretty bad, right? So something's not right with our healthcare system. Here's some more facts. So the leading cause of death for a long time has been heart disease. You're probably not really surprised by that, right? If we add all the cancers together, cancer is number 2. So, okay. Is anybody surprised by those ones? We kind of know that, right? Any guesses as to what's numbers 3 and 4?
Diabetes.
Diabetes, that's a good guess. Any other thoughts? You probably weren't expecting this. Obesity? Our medical system. And it's hard to measure this because on the death certificate, it's not going to say the doctor made a mistake or the nurse made a mistake. It's going to say respiratory failure or something like that. But really, at the end of the day, our healthcare is expensive, and sometimes it's got some negatives. So really, your best bet is not to get sick, right? So here's another reason not to get sick. 90% of all diseases aren't even treatable by our conventional treatments. And this is the World Health Organization. So this is my opinion, this is a pretty reputable source. So you're better off not to get sick. But here's why. Our healthcare system is really, really good at acute care medicine. So if you're in a car accident and you get a fracture and your knee bone is sticking out of your thigh, or you got internal bleeding, or you're having a heart attack, we can rush you to the nearest medical center. We can snatch you back from the jaws of death, a lot of the times anyway. So we have a really great system for that kind of acute care medicine. But what most people suffer with are chronic conditions like diabetes and cancer and Alzheimer's and heart disease and osteoporosis and arthritis. And you know what they all have in common? We don't have a cure. So once again, your best bet is not to get sick. I want to talk to you about health insurance. I want to try to encourage you to think about health insurance a little bit differently. Let's first talk about some of the other insurances that you may have. If you own your home, then you may have homeowner's insurance. And if you own your car, then you have car insurance. If your paint is peeling, if your carpets are worn, is your homeowner's insurance going to cover that? It's not, right? That's routine maintenance. You got to look after that. If your car has bald tires or if the brake pads are worn out, is your car insurance going to cover that? No. Now, if the tires blow and the brakes fail and you smash your car, then your insurance kicks in, right? So let's think about health insurance. It's really a little bit of a misnomer. So is life insurance, right? It's really loss of life insurance. And in the same sort of way, health insurance is really kind of loss of health insurance, because it'll pay for drugs and it'll pay for surgeries, but it doesn't pay for organic food, it doesn't pay for your new sneakers so you can go for a walk. But taking care of yourself, routine maintenance is really important, right? Because we sort of established that really your best bet is not to get sick. So routine maintenance is really important. So let me tell you a little bit about what kind of doctor I am and how I came to be this way. Because for many years I was a regular doctor. I was trained at regular medical school just like all of your other doctors. And what I was trained to do is to write prescriptions to treat your symptoms. So if your blood pressure's up, we had a pill for that. If you had back pain, we had a pill for that. If you couldn't sleep, we got a pill. And then if that pill gave you constipation, well then we got another pill. And it just keeps going, right? But in my own personal life, I was having some issues. I developed anxiety. I didn't used to have anxiety, but all of a sudden I'd get really upset over little tiny things that really weren't that important. I was irritable and cranky, and I wasn't always so nice to my husband and to my kids. And I even remember one time we were having some people over for a holiday party, and I was trying to decide what we were going to serve, and I ended up running screaming into the bedroom and slamming the door and collapsing in a heaping, sobbing mess because I couldn't figure out whether I wanted to serve pigs in a blanket or mini animals. And this was before I was a healthy kind of doctor. But it was so silly. And I recognized that something was wrong, but I really didn't know what was going on. And I was so tired all the time. My favorite thing was to have a nap. And it's hard to be a good mom and a good wife and a good doctor when you're really not feeling good. So one of the things that helped me to change was that my husband saw a book when he was at the gym, and he sort of recognized some things about me when he kind of flipped through the book. And he came home and he suggested that maybe I'd like to read this book. And I looked at it, and I looked at him like he was bananas, because it was a book by Suzanne Summers. You know Chrissy from Three's Company, right? Finance related. And I thought, I am a doctor. I do not need to get my medical information from Chrissy Snow. But I knew that something wasn't right. And so I read the book, and I have to tell you, that book changed my entire life. Because once I read about the women in the book and the results that they had, it allowed me to really open my mind, and I started to really investigate this idea of bioidentical hormones that she was talking about in her book. and I found programs where I could study, and I became certified as a specialist in bioidentical hormone replacement therapy. So as a result, I was able to address my own hormone issues that were kind of turning me into the wicked witch of, Gaston County. And in the subsequent 10 years, I've been able to help over 3,500 men and women to diagnose their hormone imbalances and help to restore their health with the use of bioidentical hormone replacement therapy. But in the process of doing that, I recognized that simply writing a prescription for a natural form of hormone replacement still isn't enough. We really need to understand what's the root cause of the hormone problem that we're trying to solve. So what I want to share with you tonight is a different way of thinking about medicine and about your health and about your symptoms that works so nicely to restore wellness, to help people come off of their prescription medications, to avoid surgeries, and to really regain that sense of vitality that we all really like.